Good afternoon. Welcome, everybody. My name's Andrew Jack from the Financial Times. Great to be here. And we're going to talk this afternoon about the future of healthcare, and particularly the increasing role of technology and the digital space. So we've got three great speakers with some very different companies and ideas about how things are being reformed, how there are brakes on progress, and to give us a bit of a picture and a vision of how things will evolve in the coming years. Why don't we just start by each of you just very briefly telling us in a couple of minutes each who you are and what your company does.
Thanks, Andrew.
Ramji.
My name's Ramji Srinivasan. I'm one of the co-founders and CEO of Counsel. We offer genetic tests at different times in a person's life. We have 3 tests on the market, one for parents planning to have kids called Family Prep. We can radically improve physicians' ability to identify couples who are at risk for passing on serious genetic disorders that can be treated and potentially even prevented before conception. Our second test is called Informed Pregnancy Screen for women in their first trimester. In the first trimester of birth, moms through their umbilical cord actually release bits of their fetal fragments. We can pick up these fragments and check if mom's kids have risk for Down syndrome, which will radically reduce the number of amniocenteses that take place. And the third test we have is our inherited cancer screen test for breast cancer, ovarian cancer, pancreatic, and other cancers that are passed from parent to child. So we've tested over 500,000 patients who are based in South San Francisco, California, and very excited to be here today.
Lisa.
Hi, I'm Mary Spio. I'm the founder and CEO of Next Galaxy. We are a virtual reality company. We have a platform for creating and managing VR content as well as delivery. In the healthcare space, we've partnered with several organizations to create fully immersive virtual reality training. For example, we have a CPR training, which is fully done in VR. So both parents as well as medical professionals can practice CPR. We have a lot of other procedures that we're creating in VR compared to the traditional way of training, which is either watching a video or through textbooks.
Lisa.
Hi, I'm Lisa Maki. I'm the co-founder and CEO of PocketDoc. We are an operating system for the business of health. We provide a set of cloud-based web services so that any software engineer can bring their mobile app, their website, their service to market at scale, regardless of whether or not you're dealing with insurance companies, with electronic medical records, or other health-based back-office systems. And also, very happy to be here. We're based in San Mateo, California, and Charleston, South Carolina.
So thanks. So let's start just by thinking where we are today with the healthcare sector. When you think about transport with taxis, you think about hotel bookings, you're thinking about the banking sector, all of them have gone through pretty radical disintermediation, restructuring. Digital information and revolution has really been at the forefront. You get the impression healthcare is still pretty antiquated in many ways. Why is that, if that's the case?
Yeah, I mean, my point of view is the incentives work exactly as they should. Everybody does what they're planning to do based on how the incentives punish and reward certain types of behavior. But that said, I think we're at the cusp of a new sort of revolution. What's really interesting is now the technology is at a stage where it enables different types of productivity. Things like mobile, like EMR integrations in doctor's office allow us to put tests in people's hands very quickly. Allow us to re-engineer things from the ground up. So although things have been backward for a while, it's really interesting to see the technology is making a major dent.
So to add on to what Ramji is saying, I think technology today, and there was a great article about it in TechCrunch this week, as a matter of fact, with the technology that exists in healthcare today, and this isn't just in the US, this is worldwide, is back office systems that largely haven't been updated or redesigned since the mid-90s, late 90s maybe. So the technology, the back office, the underlying infrastructure, what is exchanging the data worldwide is really what's preventing a lot of the applications, the new businesses, the new business models from coming to market and getting there fast enough to take hold and get traction. So that's what we focus on, because you're right, the innovation is there. There are incredible companies and technologies being built.
remaining barrier that would allow a lot of that innovation that's coming through to really go mainstream and start to create a lot more value than we're still seeing today?
Well, in the U.S., I would say it's, but I think it is accurate to say even in countries where there's socialized medicine, the business models, the existing business models, and the legacy players in those business models, those are the single greatest obstacles to introducing new business models, new companies like Mary's and like Ramji's. But as we give those companies quick ways to get to market at scale, their models will prove out. They are superior. They are patient-focused. They are driven by the customer.
Right. I think access to the technology, even for consuming the medical care, up until now has been very limited in the sense that you had to go to a medical facility to be able to access a lot of technology. But today with the presence with mobile phones, for example, being omnipresent, more and more people can access these types of technologies and bypass a lot of the legacy systems that are in place that kind of cripple access to the medical care. So I think that we're going to see more and more disruption as people have access to their own medical care through other ways other than through the medical facilities.
I would just dovetail with Lisa's point of, I think the single biggest impediment right now is incentives. So if you can fix the underlying incentives, you can change a lot of downstream behavior. For example, high deductible health plans. People want employees to be responsible for more and more spend. But the problem is you find out how much something costs in medicine 90 days after you get the service. So how exactly is it that you're supposed to be responsible for something if you don't know how much something costs? You can't go into a car dealership and say, well, I want a car, and then find out how much it costs afterwards. So we're doing things like price transparency and being able to show people on their phone instant estimates, and other companies are coming out with tools like that. But I think that's one of the key problems to solve, which is using technology to allow the right incentives to happen as opposed to waiting ad infinitum for policy changes to happen.
So let's just talk a little bit about data, which is at the heart of obviously a lot of this. You can see huge potential, whether it's identifying genetic drivers of disease, whether it's looking at clinical trials and recruitment, whether it's healthcare outcomes more generally, diagnostic tests and so on. Vast potential. Lots of interesting startups. Some of the really major IT players and others have tried to get into some of this space, but again, often not with huge degree of success. So what are some of the blocks and the potentials you see about unleashing the power of processing, presenting, collecting data?
I would say many of the solutions that have been tried to date are putting Band-Aids on broken software, or software that was appropriate in 1998 but isn't appropriate in 2015. So what we're rolling out and what we see others and the two people here with me on stage are rolling out is the same kind of technology you see behind Amazon or iTunes or Facebook. It can be applied to deliver data transactionally at scale, millions of transactions. If you're talking about a truly patient-driven experience where wherever that patient is, whatever they need is being given to them and that data is being handled securely. And I know we'll get into security, so the security methods are vastly superior now than what's being used in much of our healthcare today. That is all solvable. That's not a hard technical problem. It's just allowing us to get in past the legacy business models.
Right. I completely agree with Lisa in the sense that a lot of these technologies that we're using in terms of delivering of data, protection of data, for a lot of the data security issues that we have are actually more stringent, even in the consumer marketplace, than you would find in the healthcare. So a lot of it exists now for safely and securely delivering, whether it's entertainment or other types of content to consumers. And I think that's a vast shift in the way that we're looking at healthcare, not just from an enterprise perspective, but now applying a lot of these consumer-driven data points to how we can, deliver healthcare solutions.
Yeah, my 2 cents on this is if you're going back to technology companies that have tried in healthcare and have exited, it's usually reasoning by analogy and then saying, well, hey, or well, this worked in technology, why doesn't it work in healthcare? Or this should just work in healthcare, and people in the industry are just too slow or backward or whatever. And actually, it turns out people in the industry are quite bright and really understand their domain and understand all their flow very, very well. I mean, like, classic example is a fax machine. Fax machine, we were like, why the hell does anybody still use a fax machine? And it turns out when a doctor goes from consultation room A to consultation room B to go to a computer, log in, print something out, get it from a printer is slower than going from consultation room A and picking something off the fax machine. So I think we see a lot of reasoning by analogy. We're like, well, this works over here, but then when you try it in healthcare, it doesn't work because the workflow is set up to reward a different system. And to your point about data, I think that's going to be huge. Particularly, you mentioned like genetic drivers of disease. Things like in oncology, patients who have tumors in their blood, they actually have fragments of cancer that flowed in through their blood, and you'll eventually be able to pick these up and target specific drugs based on the mutations you find, which will reduce the number of painful biopsies you have to do, and also allow you to become very, very precise. So I think that sort of data is now emerging, which can be very powerful and improve outcomes over time.
Lisa, you touched on this, but just that question, though, of confidentiality, obviously in health, it's particularly sensitive, the implications for employers, for insurers, for stigma within the community. I mean, obviously health is not like a lot of other areas. It is incredibly sensitive, particularly clearly disease rather than health. So, I mean, are we really confident those safeguards are now pretty robust?
I'm not confident that the current safeguards in legacy infrastructure is robust, and we have evidence that's been happening, at least in the US, all year long, that it's not. To Mary's point, the technologies today that are being used in other industries to secure the data are vastly superior. It is irresponsible for us not to be using those in healthcare. And it's also, to look at it worldwide, our data as individuals, health is a personal problem. All of us have personal preferences about how we see our data used, who we want to share it with, what we want to do with it. But solving health problems is international. It is irresponsible for us not to be dealing with this internationally, to be able to cross country boundaries with data as necessary. Because disease, viruses, health will follow us as fast as we can think. And our systems, until now, are not prepared for it.
And also on privacy?
Yeah, I totally agree. In terms of data privacy, we've spent a huge amount of time engineering these systems using some of the consumer internet and enterprise security principles. But overall, if you look at things like financial security and health security, I mean, for decades, there have been a lot of protections on these, but I agree we can continue to invest more behind those because the sensitivity of this data is so important, right? When you think about HIV 20 years ago, people knowing your HIV status is a big deal. And I think we need to continue to invest in implementing those security safeguards.
Maybe let's just switch, Mary, a little bit to outcomes, the value really out of all of this new approach. I mean, give us a sense, and I'll ask the others as well, but what are some of the big radical things that could change, whether it's in terms of patient outcomes or cost efficiencies, for example, through new technologies and digital applications?
Yeah, I think, through patient outcomes, right? For example, one of the training modules that we're working with for healthcare facilities is for a tracheal insertion procedure. This procedure is a blind procedure that typically you can't even practice on a cadaver because the patient has to be sitting. Otherwise, if the doctor or the provider inserts the tube, it could go down the wrong tube. They could perforate, let's say, windpipe and other organs. So for a procedure such as this, they cannot practice except live on the patient. So by doing this in VR, they can now actually practice and also be able to feel when they're perforating organs and doing those type of things. So for the patient, there are better outcomes, and then also for the medical facility, they don't have to worry about, in the case of the state's lawsuits and other things such as that. So there are a lot of processes that today are just simply not done. Telemedicine is going to take on a whole different outcome. For us, success using VR would be to be able to have these diagnoses of people around the globe, for people to have access to medical care and be able to access first-class medical care no matter where they are. And with the prevalence of VR headsets, with them not being as expensive and everyone having a mobile phone, they should be able to get access, to medical care irrespective of where they are. So those are going to be some of the things that I think we're going to see really transform within the medical community with the technology that we're building.
Ramji?
Yeah, I think outcome-based payments are a little bit tricky. I mean, if you just consider like other service providers, let's just take a barber. How do you pay a barber based on the outcome of quality? And I'm not just saying it can't work. Is it like the sum of what your friends think or what your significant other thinks? There's probably a way to do it. But outcome is usually related to how much control you have over the outcome. For example, lawyers, it'd be great if we could pay them, particularly on the lawsuit outcome accomplished or whatever, litigation outcome accomplished. But usually the other mechanism of rewarding outcome is reputation, in that people who have an expert reputation, their price usually goes higher in the marketplace because oh, well, XYZ is a good lawyer. And although they didn't win this particular case, their reasoning was very sound, their judgment was very sound. So I think it's going to be tricky to have an outcome that actually makes sense, that doctors and clinicians want to sign up for. I mean, for us as a medical test, we are an input into a decision-making process. So while I'd love to be able to control the outcome, I don't necessarily think that we have complete control over what people do with our information. That's up to physician and patient. So I think each situation will have to be really carefully analyzed to make sure that the incentives are all aligned.
Mm-hmm.
Well, to follow on, many of you may know that in the US, outcomes is becoming a hot topic because you will be paid as a doctor by how well you do and what your outcomes are. But to try to take it, if we think about it from an international standpoint, one of the reasons why we focused on APIs and APIs that companies like Counsel, Ramji's company, and Mary's can use is you can design, and this is for the providers, the doctors, they can design any experience, any patient experience, as well as any payments experience they want in the market. The consumer can have choice. The patient can choose what procedure they want based on what outcomes they see, because typically in a free market, good outcomes are rewarded, not just the ones that are being pushed or designed into your back office system. So we're here to support the best outcomes, whatever they may be, the best products that deliver them. So I'm not only, and a little bit about my personal story, I was trying to find an outcome, a particular outcome that led me to build PocketDoc. I couldn't search for my outcomes. You can't Google options on your health. So also with APIs, hopefully anyone can find what they need wherever they are and get it, and particularly if they're willing to pay for it.
So we've only got a few seconds left, so maybe just 5-6 seconds each, but just give us your vision. Let's say go forward 20 years from now. How different will healthcare be? What will be the fundamental changes driven by digital reform?
Health insurance looks a lot like car insurance in that you pay up to $5,000 you're personally responsible for, and then over $5,000. That itself would dramatically change a lot of behavior in the system almost overnight.
Mary.
I think patients will be able to access doctors anywhere, be in the same room with them. You'd be able to do diagnosis. Doctors will be able to touch and feel patients and, diagnose and treat them no matter where they are. And it would be in the same room. The first time someone says VR saved my life, we know our job is done.
Okay. Lisa.
I think most of our health will take place in the home. It will be a managed subscription. If I have to go to a clinic and see a doctor, it will be in a driverless car operated by a private company. I can imagine who we think it might be.
Okay, well, thanks very much. Do thank, please, Ramji, Mary, and Lisa.
All right.